Welcome to the deep dive. You sent us your sources, and we've been digging in.
We have indeed.
Today, we're looking at a YouTube transcript from El Paso Manual Physical Therapy. It tackles a really common question. Does walking actually help with knee pain?
Yeah, it's something you hear all the time, right? Just walk more, or walking is great for your knees.
Exactly. So our mission today is to, well, really unpack their expert view on this. When can walking help? When might it actually make things worse? And what are the key takeaways?
And this source, it covers a lot of the typical knee complaints people have: knee arthritis, patellofemoral pain.
That's runner's knee sometimes.
Often, yeah.
Yeah.
And IT band syndrome, meniscus tears, other cartilage stuff. It's pretty comprehensive.
And what's interesting, like you said, is a nuance. They aren't just saying walk or don't walk.
Right. They see the potential upside, definitely, but there's a big condition attached.
Yeah.
It really depends on how you walk and if your muscles are, well, balanced and ready for it.
Okay, let's get into that how then. The physical therapist in the video says there are two main ways walking can sort of backfire and contribute to knee pain. And the first one, well, it might surprise people.
It probably will.
It's our basic walking technique, the thing we do all day long without thinking.
Exactly. They apparently hear it all the time in the clinic. Hold on, I've walked my whole life. Fair enough.
Sure.
But the point they make is that inefficient walking patterns done over and over, step after step, day after day, they can slowly add up, like a tiny bit of wear and tear each time that eventually leads to problems, microtrauma, essentially.
And they had that statistic from their clinic, right? Something pretty high.
Yeah, it was striking. They said something like 8 or 9 out of every 10 people who come in with knee pain.
Wow.
And that's for all sorts of issues: cartilage, osteoarthritis, ligaments, tendons, IT band, runner's knee. Almost all of them also have an issue with their walking gait.
That's huge. It really points to how fundamental walking is.
It absolutely does. And for any runners listening, they also point out that bad walking habits can feed right into running injuries, too. It's all connected.
Makes sense. Okay, so walking technique is number one. What's the second factor?
Muscle imbalance, which I think most people can kind of intuitively grasp. If some muscles around your hips or knees are way stronger or weaker than others.
Yeah, it's going to pull things out of alignment somehow.
Right. It can mess with your walking pattern, and you might not even realize it's happening. Your body just compensates.
And often it's both happening at once. The technique and the imbalance.
That's what the source says is the most common scenario they see.
Yeah.
The poor technique and the muscle imbalance is kind of feeding off each other. It's a bit of a cycle.
Okay, so if those are the problems, what's the fix? According to this PT, how should we be walking for better knee health?
Well, it boils down to a few key things, and the absolute foundation is getting your glutes involved, your butt muscles.
Actively using them while walking.
Yes, consciously engaging them. They actually suggest a little exercise you can try right now, just sitting or standing there.
Oh, yeah.
Yeah, try squeezing your glutes like 100% effort, then relax to about 50%, then just practice turning them on and off, maybe alternating sides.
Okay, I'm trying it. Feels a bit weird if you're not used to consciously doing it.
It can.
Yeah.
But the idea is just to get that connection going. Those glutes are supposed to be major players in supporting you and pushing you forward when you walk.
Right. So glute activation is number one. What else?
Foot position is the next piece. They recommend having your toes pointing slightly outwards.
Slightly out, not straight ahead.
Not straight ahead, and definitely not pointing inwards or pigeon-toed, just a little bit outwards.
Okay. They mentioned people might feel like they're walking like a penguin.
Huh. Yeah, they acknowledge that. But they reassure you that just a slight outward turn looks totally normal. Nobody will notice.
And why the outward turn? Is there a mechanical reason?
Yes, according to the source, that position actually helps the glute muscles fire more effectively. They even suggest you can test it yourself. Stand up, squeeze your glutes with feet straight, then turn your toes out slightly and squeeze again. You should feel a stronger contraction.
Interesting. A small change making a difference in muscle firing.
Exactly. It influences which muscles do the heavy lifting, and that leads into the actual walking technique they describe.
Okay, so how do you put the glutes and the feet together?
The key is, with each step you take, you consciously contract the glute muscle on the leg that's currently supporting your weight.
So if I step onto my right foot...
You give that right glute a squeeze, not a death grip, maybe like 50% of your max contraction.
Okay, 50%.
Then as you swing your left leg through and step onto it, the right glute relaxes a bit, and the left glute engages. It's this alternating squeeze, step by step.
Right. Squeeze the standing legs glute.
Precisely. They mentioned it might feel a bit deliberate or like marching at first because you're thinking about it so much.
I can imagine.
But the goal is for it to become more automatic, more natural over time, just part of your normal walk.
So why is this glute thing so important for the knees specifically?
Okay. This is the crucial link they make. When your glutes are firing properly during walking,
Yeah.
it apparently helps to quiet down overactive thigh muscles, the quads and the hip flexors at the front of your hip.
Okay, so activating the back helps relax the front.
That seems to be the idea. And this is important because, as the video explains, if your quads and hip flexors are always pulling too hard, always dominant when you walk.
They're connected to the kneecap, right?
Exactly. They can pull excessively on the kneecap and basically compress the whole knee joint.
Ooh, that doesn't sound good.
No. And think about what's getting compressed: your cartilage, the meniscus, ligaments, tendons, everything in there.
So that constant compression could be irritating everything.
That's what the PT suggests is a very likely reason why some people find walking actually makes their knee pain worse. They might be, without realizing it, just reinforcing that compression with every single step.
Wow, okay. That really flips the script on just walking more.
It really does. Which leads to the point about when walking might not be the right thing to do, at least initially.
Right. When should you maybe hold off?
Well, if your knee is already really flared up and irritated, if you've got significant pain from an angry ligament, tendon, meniscus, cartilage, whatever.
Like if even just walking around the house hurts.
Exactly. Or if simple movements like bending the knee are painful in those cases, pushing through with lots of walking probably isn't helpful. The source says the knee needs to calm down first, get into a low irritation state.
Makes sense. Let the inflammation settle before you start actively loading it.
But, and this is important, they also stress the benefits of properly loading tissues. It's not that loading is bad.
It's how you load it.
Precisely. Cartilage, ligaments, tendons, muscles, they actually get healthier and stronger when you apply the right kinds of forces to them. Gentle, expected forces.
And walking the right way with those glutes firing.
Provides that beneficial load. You're strengthening the knee's support system correctly.
Okay, so quick recap on that correct technique then. It's about
glute activation with each step on the standing leg. Aim for about 50% squeeze.
And feet slightly turned out.
Feet slightly turned out to help those glutes fire. And doing this consistently helps rebalance things, addressing that common pattern of strong quads and hip flexors, but weaker glutes.
Got it. Now, how do people actually put this into practice? It sounds like it takes concentration.
It definitely does, especially at first. The video gives some practical advice here. They really recommend setting aside specific time for focused practice, maybe 10 or 15 minutes.
Just focused walking, nothing else.
Yeah, because if you try to do it while you're, say, talking on the phone or running errands or thinking about your grocery list.
You just forget and go back to your old way.
Almost certainly. You'll slip back into those old, automatic, maybe less efficient patterns without even realizing it.
And they made that point about accumulation, right? These small bad steps adding up.
Yeah, that really stuck with me. It's not like one bad step ruins your knee, but thousands of slightly off steps day after day over years, that cumulative effect can really contribute to those chronic knee problems.
It highlights how important these seemingly small daily habits are.
Absolutely. For better or worse.
What if someone tries this and they're like, I can't even feel my glutes, or they find it really hard to activate them?
Good question. They actually address that too with a sort of troubleshooting exercise.
Okay.
Basically, you stand with feet flat, try to tense both glutes, then shift your weight onto one leg and really focus on just squeezing the glute on that side, hold it, feel it, then shift to the other side and do the same.
So isolating each side first.
Yeah, just practicing that single leg glute squeeze, getting the brain connected to that specific muscle again before you try to coordinate it with a walking motion.
Kind of like learning the individual notes before playing the song.
That's a great analogy, yeah. Practice the isolation first if the walking activation feels too difficult.
You know, this whole discussion, it really makes you pause and think. How many of us have ever actually consciously considered how we walk?
Probably very few. It's just walking.
Right. But listening to this physical therapist's perspective, it's clear that this automatic activity can have a massive impact on our knees long term.
It really can.
So for everyone listening, maybe the next time you go for a walk, just try paying attention. Can you feel your glutes working? Where are your toes pointing?
And if you struggle with feeling the glutes, try those standing isolation squeezes first. Just get that connection going.
It's definitely food for thought. If you've got knee pain and maybe walking hasn't helped or even made it feel worse.
Could your walking technique itself be part of the problem? It's worth considering, based on this source.
Yeah. And it makes me wonder, what other everyday movements, things we do completely on autopilot, might be affecting our bodies in ways we haven't even considered?
That's a fascinating question to end on. What else are we doing without thinking that might deserve a closer look?
Definitely something to mull over. Thanks for taking this deep dive with us.